Have you ever stopped to think about what happens when an eye exam turns up something weird? A problem that the doctor can't quite see? Well, it turns out that sometimes the biggest medical mysteries aren't on the surface at all, but are hiding just out of sight.
And that brings us to the big question we're tackling today. What if the cause of someone's pain or swelling or blurry vision isn't in the eyeball itself, but in all the complex stuff going on behind it? How on earth do doctors solve that puzzle?
Okay, so let's get right into it. An ophthalmologist exam is, incredibly powerful, but even it has limits. To really figure out what's happening in the orbit, that's the bony socket that holds the eye, or with the optic nerve, or even deeper in the brain, doctors need a way to see what's invisible. And that's where radiological imaging becomes an absolutely essential tool. To solve these kinds of medical mysteries, clinicians have this amazing toolkit, and you can really think of them like a detective's gadgets for gathering clues. The two main tools we're going to talk about are computed tomography, you probably know it as a CT scan, and magnetic resonance imaging, or MRI. First up, we've got the CT scan. The easiest way to think about this thing is as a superpowered 3D X-ray. It's crazy fast, and it is fantastic at one thing above all else, seeing hard structures. It is the ultimate bone detector, perfect for spotting fractures or little foreign bodies or any kind of calcification. And then you've got its partner in crime, the MRI. Now, this machine uses a huge, powerful magnet instead of radiation. And its specialty? Well, it gives you this unmatched, incredible detail of soft tissues. So if CT is the bone detector, MRI is the master soft tissue mapper. It gives doctors this crystal clear view of all the nerves, muscles, and of course, the brain. And what's so interesting when you see it laid out like this is that you realize the choice for doctors is really a series of trade-offs. A CT scan uses radiation, an MRI doesn't. CT gives you amazing bone detail, but MRI's view of soft tissue is just way, way better. And this is a big one. CT is super fast, which makes it perfect for trauma situations, whereas an MRI is slower, but way more detailed. So what it all boils down to is this. The choice totally depends on what the doctor thinks is wrong in the first place. But what if you need to make the clues stand out even more? I mean, really make them pop. That's where contrast agents come in. Think of it like a detective at a crime scene using a special chemical spray. It's designed to make certain pieces of evidence, like a tumor or an area of inflammation, basically just light up and scream, "Look at me!" So here's how it works, in a nutshell. A special agent, it's either iodine-based for CT or gadolinium-based for an MRI, is put into the bloodstream. As it circulates all through the body, it tends to build up in areas that have more blood flow, which is super common with things like tumors, infections, or inflammation. And then those areas just light up on the scan, giving doctors this bright, unmistakable target to look at. Okay, so once the images are captured, this is where the real detective work starts. A radiologist's job is to decode all these images, looking for patterns that help them characterize what they call a lesion, which is really just a fancy term for any area of tissue that looks abnormal. It's all about figuring out, what kind of problem are we actually looking at here? And this is not some random search. As you can see here, clinicians follow a really systematic checklist. They look at things like, where is this lesion located? What's its size and shape? Are the borders nice and smooth, or are they kind of messy and irregular? How does it react to that contrast eye we were just talking about? And very importantly, is it pushing on anything around it? Every single one of these features is a critical clue. All right, let's open our first case file, inflammatory lesions. Now, you can think of these like a crime scene that's just messy. On a scan, they often have these fuzzy, ill-defined borders. They almost always light up super brightly with that contrast eye, and it might even be spreading across a few different structures nearby. So when a doctor sees this pattern, the clues start pointing toward a diagnosis like an infection or maybe an autoimmune disease. Now let's look at our second case file, tumors, or what doctors call neoplastic lesions. Their appearance can change a lot depending on the type, but a really key clue is often the effect they have on the neighborhood. A growing tumor can act kind of like a bully, pushing the eyeball or the muscles right out of the way. And on the skin, you can actually see this displacement. It's called a mass effect, and it's a huge tell that something is growing where it really shouldn't be. And for our final case file, we have cystic lesions. Now, this one is often the most straightforward pattern to spot. Because cysts are basically just sacs filled with fluid, they have a very distinct look. They show up dark on a CT scan, but really bright on an MRI. They usually have these clean, round borders, and unlike tumors or inflammation, they don't light up with that contrast eye. It's a whole collection of clues that points to a pretty clear-cut diagnosis.
So, after we've looked at all the evidence, we come right back to our central theme. You have to choose the right tool for the job. The success of this whole diagnostic process really hinges on making that right choice between a CT and an MRI, right from the very start. So here's the bottom line. If a patient comes into the ER after, say, a sports injury, and the doctor suspects a fracture in the orbit, well, you need speed and you need perfect bone detail. In that case, CT is the undeniable expert. It gets you the answer, and it gets it to you fast. But what if a patient comes in with blurry vision that's been getting worse over time, and there's no obvious reason why? Then the suspicion shifts to the optic nerve, or maybe the brain. For that, you need the master of soft tissue. You absolutely need the incredible detail of an MRI to see the tiny, subtle changes that could be causing the problem. And that really brings us to this final, really powerful idea. These incredible technologies, they don't replace a doctor's exam, they extend it. They're what allows a clinician's senses to go beyond the surface, to actually see inside the human body and solve mysteries that would otherwise be completely invisible. Which just leaves you with this fascinating thought to chew on. We've seen how CT and MRI completely changed medicine by letting us look behind the eye. So as these imaging tools get even more advanced, even more powerful, what currently invisible mysteries of the human body and the brain will we finally be able to solve next?